Hi, my name is Pradeep Chopra, and I'm going to be talking about the mechanism of a drug called LDN, also known as low-dose naltrexone. Um, I don't have any potential financial disclosure for this. This presentation or discussion is not meant to be to take the place of your doctor. Um, and my other disclosure is that I am a pain medicine specialist, and I teach at the Brown Medical School. So the drug we're talking today is called naltrexone. Naltrexone is an old drug. It was approved about 30 years ago by the FDA for the treatment of alcohol and heroin addiction. But this is not what we are going to talk about today. We are going to talk more about its use in a very low dose, and hence called LDN, or low-dose naltrexone. Naltrexone is a reversible competitive antagonist of the mu and kappa receptors. What that means is that naltrexone, all drugs in our body work as a key and a lock mechanism. So every key fits into a specific keyhole, and then that opens up a lock. And if you put a dummy key into that keyhole, then the lock does not get unlocked. Naltrexone is one of those drugs that works on a keyhole called the mu receptor and the kappa receptor. These receptors are the receptors that which morphine and opioids work on. So if I was to give someone naltrexone, this would block the mu receptor, which means it would block that keyhole where morphine acts or opioids act, and block the effect of these drugs. It also works on the delta receptor to a lesser extent. Once naltrexone is taken into the body, it is then converted by the body into something called 6-beta naltrexone. 6-beta naltrexone has a reversible, it works the same as naltrexone, but it has a much lower effect. So the plasma half-life of naltrexone is 6 hours, and this is really important to know because what it means is that the body processes half the dose of naltrexone in 6 hours. In other words, in 24 hours, which is 4 times the half-life of a drug, the drug is completely eliminated from the body. So if a drug was to had a half-life of 2 hours, then in 8 hours it would be completely eliminated. In case of naltrexone, it's 6 hours. So in 6 hours, and then in 24 hours, it's completely eliminated. But that's when you're taking a full dose, which is 150 milligrams per day. Over here, we're talking about low-dose naltrexone, which varies from 1.75 milligrams to 4.5 milligrams. So what happens is when you give someone low-dose naltrexone, it blocks the receptor. It blocks the opioid receptor for a very short time because it's a very small dose. Instead of giving them 150 milligrams, we're now giving them 4.5 milligrams. When you give them 4.5 milligrams, it blocks only a few of the receptors. Now, when that happens, the brain thinks that we need to produce more endorphins, also known as endogenous opioids. So the brain, in turn, gets a signal that, well, it's not producing enough endorphins, so the brain starts to produce more and more endorphins, as a result of which the endorphin levels increase. And as you know, endorphins are the most powerful painkillers in the world. I want to talk to you a little bit about the opioid growth factor. That's just a scientific name for it. But the opioid growth factor, also known as the OGF, it belongs to a group of compounds called metcaphalins. It is produced by the human body, and opioid growth factors work on something called the opioid growth factor receptor. So the combination of opioid growth factor and opioid growth factor receptors regulate cell growth in normal and abnormal cells. So the concept is that the body produces opioid growth factors, it works on the opioid growth factor receptors, and the two together help in cell growth in normal and abnormal cells. The beauty of this is that low-dose naltrexone, which blocks opioid receptors, it increases the production of opioid growth factors and opioid growth factor receptors. And when that happens, it helps increase the number and the density of opioid growth factor receptors, which means that it can also help in tissue healing and repair. The next thing I want to talk to you about was the effect of LDN on glia. Glia, the brain and the central nervous system, that is the brain and the spinal cord, 70% of our brain and spinal cord is made up of something called glial cells. Glial cells were considered to be packing material. And so the idea was that there were nerve cells in the body that, in the brain and the spinal cord, that were packed around, protected by glial cells. This actually is not just a pictorial, it's a neuron, this is the nerve cell. And the glial cells, these are different types of glial cells, they are different kinds. These glial cells are in very close proximity to the neurons. They're literally almost stuck next to these nerve cells in our brain and spinal cord. And the function of these glial cells is to protect these nerve cells. They're part of the immune system in our brain. When these glial cells get activated, they get really upset. And when they get upset, these activated glial cells produce something called pro-inflammatory cytokines. These cytokines, some of them are called the TNF-alpha, or the tumor necrosis factor alpha, and the interleukin-1 beta. There are many, many cytokines that are produced. These are nasty chemicals. They cause pain. They cause inflammation. They cause the nerves, the very nerves that they were next to, now get inflamed. So these guys get upset. They get activated. They produce different kinds of chemicals that make this nerve inflamed. And when that nerve gets inflamed, we have pain. So the other thing about activated glial cells is that these glial cells produce glutamate, and glutamate triggers NMDA receptors. NMDA receptors, as you all know, is where ketamine acts. Ketamine acts to block NMDA receptors. So when these glial cells get activated, they release a neurotransmitter, an excitatory neurotransmitter called glutamate, which then triggers these NMDA receptors. As a result of which, the nerves begin to fire even more and more. And this is where LDN comes in. LDN decreases this neuronal firing by preventing these glial cells from getting activated. So we have LDN will prevent the glial cells from getting activated, which decreases neuroinflammation. It also acts on the NMDA receptors to prevent them from getting excited. The next thing I want to talk to you about was Toll-like receptors, where LDN works again. Toll-like receptors are a type of protein that is part of our immune system. They are produced in our body, and there are many types of Toll-like receptors, also known as TLR. So what happens is, when there's an infection, when there's a foreign body, or when there's an enemy agent in our body, these Toll-like receptors, they go and attach to these foreign bodies. So they go and attach to the bacteria. And that's how the immune system then recognizes it and it activates the immune system. Among the Toll-like receptors, there is one particular called the TLR4, which is produced by the microglial cells, the Toll-like receptor 4 or TLR4. What happens is, when there's inflammation of the brain and the spinal cord, these Toll-like receptors are upregulated. They are more activated. There are certain conditions that cause these Toll-like receptors to get activated, and one of them is opioids. So opioids in turn cause activation of the Toll-like receptors, which then makes the glial cells activated, which then causes release of cytokines. So drugs like Naltrexone, LDN, which blocks glial cells, which blocks TLR4 signaling, reduces pain. So in summary, this is to summarize how LDN works in pain. It transiently blocks the opioid receptors, leading to a positive feedback which causes more production of endorphins. LDN increases production of opioid growth factor. It increases the number and density of the opioid growth factors, receptors, and this helps in tissue repair and healing. LDN also blocks effect of TLR4, Tolllike receptors, which decreases glial cell activation, which then in turn decreases neuroinflammation. Thank you.